Let's discuss the second part of this test. Question number 26. The palpable vibrations transmitted through the bronchopulmonary tree to the chest wall when the patient speaks is known as. Correct answer is A. Tactile fremitus. Question number 27. In order to follow the sequence of the interview with client, which of the following the nurse should do first? Correct answer is C. Greet the patient and establishing rapport. Question number 28. He/go to work by bus every day. Correct answer is B. Does he go? Question number 29. If you told me, I'd support you. Correct answer is C. Would. Question number 30. A special test for appendicitis in which nurse palpate deeply in one of the four abdominal quadrant and quickly withdraw palpating hands to avoid the danger of rupture is called. Correct answer is C. Rebound tenderness. Rebound tenderness is a clinical sign in which there is pain upon removal of pressure rather than application of pressure. Question number 31. An outbreak of a contagious disease is identified in a specific region. What is the primary goal of epidemiological investigation? Correct answer is B. Identify the source and control the spread of the disease. Question number 32. Computer-assisted instruction is based on dash principle. Correct answer is B. Operant conditioning. Question number 33. Alopecia is referred to as. Correct answer is A. Loss of hair. Question number 34. A new nurse is transitioning into a leadership role. What is a key aspect of successful role transition? Correct answer is B. Seeking mentorship and developing leadership skills. Question number 35. The hunter killed the lion. Pick the correct passive voice of the given sentence. Correct answer is A. The lion was killed by the hunter. Question number 36. Central cyanosis is best identified in the. Correct answer is D. Lip, oral mucosa and tongue. Question number 37. A nurse is working in a multicultural setting and encounter different cultural health practices. What is the most appropriate approach? Correct answer is B. Understanding and integrating cultural practices into the care plan where appropriate. Question number 38. I don't suppose you are telling us the true version of the story, dash. Correct answer is A. Are you? Question number 39. The mitral sounds are louder at the dash of the heart. Correct answer is B. Apex. These are routine chest sites for heart valve auscultation. Question number 40, antonym of meticulous is. Question number 41, how should a nurse address religious dietary restrictions in patient care? Correct answer is B, discuss and accommodate the dietary preferences in the care plan. Question number 42, antonym of tedious is. Correct answer is D, interesting. Question number 43, what is the indirect speech form of the question are you coming to the party? Correct answer is B, he asked if you were coming to the party. Question number 44, a patient is prescribed a new antihypertensive medication. What is an important aspect of patient education? Correct answer is D, monitor blood pressure regularly and report any significant changes. Question number 45, audible stridor, a high-pitched wheeze, is an ominous sign of. Correct answer is A, airway obstruction. Question number 46, hornet's nest means. Correct answer is C, a violent situation. Question number 47, I can't think traveling pubic bus. Correct answer is B, of, by. Question number 48, during abdominal assessment you noted irregular heartbeat, what is next appropriate next step? Correct answer is B, assess the apical pulse for 1 full minute. Thank you. For any suggestions, comment below.